Hi, my name is Sabrina Peer, and I will be discussing the case of Felicia. Question 1, is there any aspect of Felicia's life that you can relate to? I cannot relate to any aspect of Felicia's life, but having two children, I myself have two children, a 5-year-old and a 3-year-old. And their father is active. She did say that one of the fathers is involved, but their father is involved because it's only one father. Um, and I do have empathy for her situation. Um, Question 2: if not, what approach will you take in establishing repertoire? Rapport. The approach I would take is strength based approach and trauma informed. Basically due to the trauma that she went through, like sexual abuse, um substance abuse, being put into foster care, so DHR is involved. I would try to create I would definitely create a safe space for Felicia to feel open, to express herself and feel heard, and to express her feelings without any judgment. Also, I would avoid like shaming her and making her feel bad about her situation. Try to move towards treatment or some kind for substance abuse, and have her comply with the classes that she's supposed to be taking. Question 3: what aspects of Felicia's family history can in part explain Felicia's dependence on substance? When Felicia was molested by her mother's boyfriend and her mother did not believe her, the substance abuse, watching her mother as well abuse a substance, not having active parents. She stated that she seen her mama laid out on the couch. She'll be gone for days. Getting removed from her home with her mother, and being put into foster care, being separated from her sister, that took a toll as well. Her father being incarcerated as well. He dealt with drugs as well. Just the adverse childhood, her adverse childhood experience, it can lead to substance abuse. So helping Felicia find ways to manage these emotions and trauma symptoms, and figure out ways to help her with ways to cope daily. Question 4: what additional information do you need to gather to determine whether Felicia has substance use disorder based on the DSM-5? So for the DSM-5, I had to go and find like a digital copy of it because I had to pick that up from the library. But to answer the question, based on from the case study and from the DS5, it's showing that we need additional information. Frequency, duration of alcohol and cocaine use. She has loss of control of the substance use. Her parenting has been impacted. Employment has been impacted. Strong cravings for whatever substance she is using. This information will help determine and help see like how severe she is in her substance abuse, how low it could be, moderate or so. And as a social worker, figure out what the appropriate way to help Felicia with her substance use, appropriate plan to see what steps she needs to do and what steps the social worker can do to help Felicia gain control and especially getting her kids back. Question five, sorry. Are there any other mental health issues that you think Felicia is experiencing? Sorry. Some other mental health issues that Felicia could be experiencing is anxiety due to her intake form. So she stated in her intake form that she had red eyes and mouth shaking and sleep deprivation. And she used whiskey to help her sleep. So anxiety, and somewhat anxiety from being molested as well as a child. Possibly, I was thinking maybe like postpartum depression because she just had a baby like 3 months ago. And as a woman, when you just have a baby, your body is still trying to contract and get back to its regular, your mind trying to get back to its regular mental state, and your body is trying to go back to the way that it was. So she could possibly have some type of postpartum depression. Also, I think depression, just depression as well. She only has one father that's potentially an active parent. She had to break up with her boyfriend because her children are gone to foster care. That's another one. She does not have a source of income. Her boyfriend was her source of income, but they broke up, so he's no longer helping. But a further assessment needs to be done to really diagnose Felicia on her mental health, just to see and make a informed decision on her treatment plan.